Hello, my name is Kevin Becker, and I am the Regional Division Chief of Hematology-Oncology for Maimonides and Downstate Health Sciences University. September is National Sickle Cell Awareness Month, a time intended to bring attention to the need for research and better treatment for sickle cell disease. Sickle cell disease is an inherited disorder of red blood cells that affects approximately 100,000 Americans. In New York State, Kings County has the second highest incidence of sickle cell disease. In the US, it is most common in descendants of sub-Saharan Africa, but also affects descendants of Latin America, India, the Middle East, and Mediterranean countries. It's a chronic disease that affects multiple organ systems in adults and children with a high burden of morbidity and a negative impact on life expectancy. Transfusions can be life-saving for patients with sickle cell disease, and I want to encourage everyone to donate blood so it's available when patients need it. Preventative measures, including antibiotics and screening Doppler ultrasound, can reduce the complications of sickle cell disease but are underutilized. Currently, the only curative treatment is stem cell transplant, but the procedure involves significant risk and the population of patients who can benefit is limited. There is great unmet need for better treatments to reduce the suffering caused by this disease, but there has been recent progress. 2 new drugs were approved by the FDA for the treatment of sickle cell disease just within the last 5 years. The potential for gene therapy to revolutionize the treatment of this disease is even more exciting. Early studies have shown dramatic symptomatic and physiologic improvements in patients with severe sickle cell disease, and additional studies are underway to determine if this could be a path to a functional cure for more patients with sickle cell disease. In closing, I want to acknowledge the families and patients living with sickle cell disease and the physicians and researchers working to improve our treatments and find a cure for this disease.